Hello everyone, this is Mila. Today I'm reading chapter 17, Cellular Nutrition, Putting It All Together. I have spoken of some of the most frustrating or painful disease doctors encounter in their patients. But I must now testify to the deepest fulfilling of a physician, watching men, women, and children of all ages living life at the fullest against after a debilitating disease. These people are back in control of their health instead of their illness controlling them. But there is honestly truth. I have never seen patients achieve this kind of response with traditional medicine alone. You could look at one or two cases and believe that the results were supernatural miracle of God. But this natural healing ability has been there all along. We have been marvelously and wonderfully made. Medical science is now just showing us that we have optimized this natural healing system that are already present. We must take advantage of humanity's most tremendous assets in healing, the host, which is our own body. Sometimes the physician has a tough time getting any healing to occur. Nothing frustrates a physician more than dealing with a compromised immune system. This happens frequently with people suffering from full-blown AIDS or those who have been taking chemotherapeutic drugs. The infection these patients get are severe and sometimes remarkable unusual. Because the patient's own immune system is barely functioning, physicians are left with few options other than to pull out their most patent antibiotic on wish and a prayer that the patient will respond. In this settling, the physician realized the most important of having an immune system that is working at the optimal level. Our drugs may be great, however, without the help of our body's own healing power, they're really not that effective. Doctors need both drugs and healthy immune system. Again, this is why I call the use of high-quality nutritional supplement complementary medicine. Optimal level of nutrition. You must remember, especially if you are a healthcare practitioner, the vitamin E, selenium, calcium, magnesium, vitamin C are simply nutrients that we should be getting from our foods. But we continue to study them as if they were drugs. Drugs must go through rigorous clinical trial to assure they are safe and effective, because they are synthetic substances that disrupt natural enzyme system in order to create therapeutic results. In the last chapter, I discussed possible safety risks posed by nutritional supplements, but the risks are few, especially compared with drugs. This is because vitamin E, the risk, and vitamin C, selenium, so on are actually natural substances that supporting natural enzyme, antioxidant, and immune system. Because we now have the means of producing nutritional supplements, we are able to providing these nutrients at the optimal level. Optimal level are those levels that have been shown provide health benefit in medical literature. These are not RDA level. See chapter 16. When these nutrients are combined and taken together in supplementation at the optimal levels, the results are simply amazing. Cellular nutrition is simply providing all nutrients to the cell at the optimal level. This allows the cells to decide what it really does and does not need. I don't have to worry about determining which nutrient the cell is deficient. I simply provide all of the important nutrients at optimal level and let the cells do their work. The approach corrects any nutritional deficiency over the next few months. Bakers know the true art of baking bread, but with the handy use of automatic bread machine, just about anyone can give it a try. We don't have to do much anymore in the way of technique. If you dump in all the right ingredients in the right balance, it's even guaranteed thanks to pre-mix packing. You get a luscious, warm load of fresh homemade bread in about a couple of hours or so. But what if you don't have a little packet of ingredients and you forget the yeast? What if you use too much salt? Is this the same approach we use the cellular nutrition? You want to provide all the necessary nutrients that the cell have everything it needs to operate its optimal level capacity. Protecting your health. Nutritional supplementation is really about health, not disease. Attacking the root cause of chronic degenerative disease is a true preventive medicine. I realize that most of my readers enjoy good health and want to continue. Although I have shared many stories about patients who have developed a serious illness and were able to take back control of their health again. Everyone would agree that it's much easier to maintain health than it's try to regain it. By applying these same principles, you who are in good health can decrease the risk of developing this chronic degenerative disease. And those who are struggling with their health can empower your body to fight, if not reverse, chronic disease. When you combine a healthy diet, moderate exercise program, cellular nutrition, you always win health-wise. Isn't this your goal? The fact is, an apple a day won't keep the doctor away. Today, you needed to supplement your apple and the rest of your well-balanced diet, high-quality nutritional supplement. Here I want to advise you for the basic nutrition you needed to provide optimal cellular nutrition for your body. When you provide all of these nutrients at the optimal level, your body receives all the health benefits nutritional supplementation provides. LDL cholesterol is more resistant to oxidation. Homocysteine level decrease. Your eyes have greater antioxidant protection from the sunlight. The lungs have optimal protection. You enhance your immune system and antioxidant defense system. You decrease the risk of developing heart disease, stroke, cancer, macular degeneration, cataract, arthritis, Alzheimer's dementia, Parkinson's disease, asthma, diabetes, MS, lupus, and more. Remember, this toxic world combined with our stressful lifestyle make it imperative that our immune system and antioxidant defense system are firing on all cylinders. Optimizer. Sometimes a patient needs more than those nutrients listed in the table 1. If a patient is suffering from lasting fatigue or a chronic degenerative disease, he's under even more oxidative stress than normal. So add what I call optimizer to his supplement program. These antioxidants are proven to be extremely patent. Nutritional supplements are continue looking for more and more patent antioxidants. But presently, the best is grapeseed extract, which is loaded with proanthocyanidins. These are very potent antioxidants that fall in group of antioxidants called bioflavonoids, found in the colorful parts of fruit. Grape seed extract offer antioxidants are 50 times or more potent than vitamin E, 20 times more potent than vitamin C when used with all of other antioxidants supporting nutrients. Used alone, it is only 6 to 7 times more potent than vitamin E and 3 to 4 times more potent than vitamin C. Here's again the power of synergy among nutrients is clear. Don't forget one of the most important characteristics of grape seed extract, the fact that it's crossed through the blood-brain barrier easier. See chapter 13. In other words, it gets into the fluid around the brain, spinal cord, and the nerve most readily. For fragile patients, I usually recommend adding at least 100 to 200 milligrams of grape seed extract, depending on the severity of their problem. Usually, it will take only 4 to 6 weeks before my patients are able to notice significant improvement and feel normal again. They actually back off their optimizer at this point as long as they continue to do well. Patients who are already suffering from chronic degenerative disease such as MS, heart disease, lupus, Crohn's, cancer, or Parkinson's are already in serious trouble. In this settle, even normal everyday free radical production causes significant oxidative damage to the fat, protein, and the DNA of the cell. The repair system are so overwhelming, they simply are not able to keep up and repair all of the damage. This patient needs significant more potent antioxidant if they are to have any hope of capture their disease and redeem their health. Again, in this situation, I also recommend optimizer to be added to the basic cellular nutritional program recommended in Table 1. The first optimizer I will usually choose is a grape seed extract. But for those struggling with chronic disease, I will also recommend much higher dose than I would for patients with just fatigue. Other optimizer will be Q10, glucosamine, sulfate, lutein, zeaxanthin, niacin, magnesium, and calcium. Follow are the basic principles and nutrients I use to optimize in this various chronic degenerative disease. All of my patients are taking the nutrients detailed in Table 1, then add additional optimizer to the basic cellular nutritional program according to the seriously of each individual case. Other than grape seed extract, the optimizer I recommend most is Q10. This is not only a potent antioxidant, but it is also essential for creation of energy within the cell. In addition, Q10 is a very important nutrient in enhancing the immune system. Note, Q10 is difficult to absorb. I'm giving level for the powder form in the following recommendation. You will need less Q10 if you take the Q-gel or self-gel form of Q10. Specific optimizers I recommend be added to the nutrients in Table 1 for each of this particular disease. Heart disease. Add approximately 100 mg of grape seed extract and Q10 along with some additional magnesium, about 200 to 300 mg per day. I feel that it's critical for this patient to be taking a basic products that contain a mixture vitamin E's, as I mentioned in Table 1. If one's homocysteine level does not drop below 7, with just the B vitamin list in table 1, I will add 1 to 5 grams of TMG, trimethylglycine, to the patient's regimen. Cardiomyopathy, I add 300 to 600 mg of Q10 to a patient's regimen along with some additional magnesium and 100 grams of grape seed extract. Patient will usually see a response within 4 months. Q10 is very safe, and the top researcher in the country felt comfortable pushing to 600 mg daily if the patient is not responding to the lower dose. However, some cardiologists like to perform blood level testing on the amount of Q10 in the blood before they begin to push to those higher levels. Cancer patients. It is hard to give a simple formula for all the various cancers, but if there is no evidence of the cancer spreading, or the surgeon believes the total remove it, I will add 200 mg of grapeseed extract and Q10. If the patient has metastatic cancer that spread, I will recommend 300 mg of grapeseed extract along with 500 to 600 mg of Q10. Children aged 8 to 15 should take only half of the recommended level on table 1. The half of the grapeseed extract and Q10 recommended here. Macular degeneration. For patients with this condition, I primarily add 300 mg grapeseed extract to the nutrients found in table 1. I also add approximately 6 to 12 mg of additional lutein to the regimen. I also found that if their patients are going to improve, it will occur within the first 4 months. Multiple sclerosis. My patient with MS have shown that at least 400 mg of grapeseed extract, 200 to 300 mg of Q10, and even some additional 5 to 1000 mg of vitamin C can be helpful in this disease. I warn my MS patient that it may be more than 6 months before they see any improvement. Lupus and Crohn's disease. This patient needs about 300 mg of grapeseed extract, 200 mg of Q10 added to the basic supplements. Again, if this patient improves, it's usually after about 6 months. Osteoarthritis. I add 15 to 2000 mg glucosamine sulfate and about 1 to 200 mg of grapeseed extract. I have no problem if they also add 400 to 600 mg chondroitin sulfate or even 100 mg of MSM if the patient feels this help. I do not feel the medical evidence is strong enough at the time to absolutely recommend them as an optimizer. Rheumatoid arthritis. Again, I add 1500 to 2000 mg of glucosamine sulfate, 300 mg of Q10, 400 mg grapeseed extract, 200 mg of additional magnesium and calcium. And I increase the omega-3 fatty acid by adding 3 to 4 fish oil capsule or 2 teaspoons of cold pressed flaxseed daily. Osteoporosis. For this patient, I do not recommend adding optimizer to my recommendation on table 1. However, I strongly encourage them to be getting the right level of vitamin D, calcium, magnesium, and to be sure they are taking this with food. They also needed to get involved in an aggressive weight-bearing exercise program for the upper body. Asthma. I add 200 to 300 mg of grapeseed extract. Children should take about 2 mg per day, along with additional 1000 mg vitamin C. Children 200 to 500 mg and 200 mg magnesium. Children should add additional 100 mg. Emphysema. The basic nutrients in Table 1 are usually sufficient. I also add 200 mg of grape seed extract along with additional vitamin C and magnesium as indicated above under asthma, Alzheimer's, dementia, and Parkinson's disease. As I mentioned earlier, this patient have already lost a significant number of brain cells before diagnosis is even made. I have seen some significant improvement with Parkinson's disease, although if the patient start an aggressive nutritional program early in his disease, I recommend adding 400 mg of grape seed extract to the regimen on Table 1. It is good medical evidence that the progression of Alzheimer's disease and Parkinson's disease may be slow and with this regimen. Diabetes mellitus. I add approximately 100 to 200 mg of additional grape seed extract to this regimen. The cellular nutrition list on Table 1 definitely provides everything else the body needs. Chronic fatigue fibromyalgia. I add 200 to 300 mg of grape seed extract along with 100 to 200 mg of Q10 to the basic supplement program. Sometimes I need to increase the grape seed extract to 400 or even 500 mg daily in order to capture this disease. Once patients are respond favorably, the amount can be decreased to a lower maintenance level. Need more help? This recommendation may seem overly simple to you, yet are the principle I have used to achieve the results I have shared with you in this book. It is not within the scope of this book to share with you my specific recommendation for each and every disease. I refer you to my webpage at www.nutritionmedicine.net to get specific advice for the disease in which you are most interested. On my webpage, I spell out recommendations in much greater detail. These are what I have used in my medical practice for more than 50 of this chronic degenerative disease. I also offer for a reasonable charge individual email nutritional consultation for those who wish to contact me directly. If you become a member of my webpage, you will unlimited access to the webpage, receive my bi-monthly newsletter, and pay reduced consultation fee. Choosing your nutritional supplement. My purpose to writing this book is not to recommend any particular brand or type of nutritional supplement, but there are a few basic guidelines you need to follow in order to assure that you are taking high-quality nutritional supplements. I strongly recommend that you do not simply sell your health to the lowest bidder. Once you finally become convinced that nutritional supplement can offer you a health benefit, you want to be sure you are getting what you pay for. You are not getting the optimal results I share in this book when you take low-quality nutrition. As you will learn, this is poorly regulated industry. You will take some effort on your part to check out the quality of particular products you choose to buy. But it is crucial that you purchase high-quality supplements that are completely and balanced. If you are going to have any chance to protect or redeem your health, as in any industry, the raw products used and how these products are manufactured affect their quality. I now advise my patient to purchase the best quality of supplements they can afford. Everyone needed to assess the importance of his or her health, what value he or she places on. I realize that it can be a significant economic decision for most people. I look at nutritional supplements as my health insurance. Once you lose your health, it's very difficult to regain it. no matter how much money you are willing and able to spend. When you look at my basic recommendation found in Table 1, you will quickly realize that you cannot get this amount of supplementation in simple daily multivitamin. You need to choose a supplement that is as complete and balanced as possible. Several companies are now putting all of these nutrients together in 1 or 2 different pills in order to achieve these optimized levels. However, you will most likely need to take several 4 to 8 tablets daily. The more antioxidant and the more various antioxidant your supplement provides, the better. You must also be sure that you are getting all the minerals and B cofactors. You need to spend a little time investigating the nutritional company you choose. You can locate a lot of information on the company's website, or you may need to call the company directly. The most important things to find out is whether the particular company you choose follow good manufacturing practice, GMP, for pharmaceuticals. This company produces what is called pharmaceutical grade supplements. This means the company follow similar guidelines for producing its products as company making over-the-counter drugs. The government does not require company to do this. However, some companies want to give their customer the assurance that they are getting what they are paying for by producing high-quality pharmaceutical-grade products. These high-quality manufacturers will put the actual amount of nutrients found in their products on the label and give full disclosure of all their ingredients. You may also find the expiration dates on the bottle. This is really nice. And the company full address, encourage sign that is actually street address rather than PO box. Another aspect to look for when you are searching particular company is where it markets its products. A company marketed internationally usually has to follow higher standard than those companies who market only in the US, Canada, and Australia, and Western Europe countries have the highest standard for the manufacturing nutritional supplements. Some of these companies will also periodically send officials to perform on-site inspection of this manufacturing plant. It is really nice if the company is able to show you a third-party certification document in the quality of manufacturing practice. Does all of this sound too picky? The November 1997 Tufts University newsletter report a study at University of Maryland that looked carefully at 9 different prescription prenatal vitamins. They did not look at what was in them, but instead looked to see if they even dissolve. If the pill doesn't even dissolve, it doesn't really matter what it is in there. They discovered that only 3 of the 9 prenatal vitamins even dissolve. This is correct. Only 3 of the 9. The pills that dissolve were produced under what are called U.S. Pharmacopoeia (USP) standards. These are government guidelines that assure you and me that medication and supplement tablets will be absorbed by our bodies. Pharmaceutical GMPs are worthless if the company does not also follow USP standards for the dissolution of the tablet. Choosing a company that follows the USP guideline is certainly a step in the right direction. Sometimes it's quite different to find out information about the quality control that various companies use in their manufacturing practice. The number of nutritional supplements that are viable on the market today alone may overwhelm you. Even every company is trying to find its niche in this ever-competitive market. Looking through the market hype and try to get to the heart of the completeness and the quality of their nutritional products. Hopefully, this guideline will help. If you were to put all the medical advances made since the beginning of records history into a 24-hour time period, the medical evidence presented in this book would have occurred within the last 5 or 6 seconds. This is cutting-edge medical research. Most physicians and healthcare practitioners have yet to come on board and make this research practical for the average and everyday person. Be that as it may, the simple concept of cellular nutrition is the best way to defend yourself from the underlying threats of oxidative stress. By combining a healthy diet, a moderate exercise program, cellular nutrition, and you are giving yourself the absolutely best chance to protect your health or to redeem it after it has been lost. You have learned the power of complementary medicine. The wide variety of true clinical stories presented in this book demonstrate the amazing healing power of bodies possess. The patient whose story I have shared with you still have their underlying disease. Many are still taking significant amounts of medication, yet they are living life to the fullest. When physicians take advantage of this most tremendous asset, the host, our body, and support it rather than deny the importance in the healing process, phenomenal clinical improvement is possible. Tricia Rose, in her powerful book titled Taking Up Your Cross, shared a profound and fitting piece of wisdom for us here. Always remember brevity of life, the certainty of death, and the length of eternity. We are not going to live forever in this earth suit. They will wear out, and one day our full redemption will draw nigh. But in the meantime, these health concepts are the best way to care for and protect our health. And may we all live until we die. I want to make my sincere thanks to Dr. Ray Strand to writing these phenomenal books. Give yourself a thanks to make this far. By now, you have some nutritional knowledge. Hopefully, you bring this nutritional knowledge to benefit yourself, your family, and your friends. If you have any question regarding in the book or nutritional brands, feel free to contact me in the description. I want to close this with my favorite quote. May we all live until we die. Thank you so much. I will see you in the next book.